Hi, this is Dr. Goodman. I wanted to go over with you a patient that came in just to kind of give you an idea of the process or flow in my office with patients as they come in. Of course, everybody's going to be a little bit different, but I thought it would be a good idea to kind of a fun idea to share with you what it looks like. Maybe if you haven't been to a chiropractor, you kind of see what the process looks like. So the person that we're gonna review here, to avoid using her name, we'll just call her Julie, and so we'll go ahead and start. So Julie comes in. I usually invite them in to sit down and talk to them. Sometimes they'll stand if they're hurting, but I just review with them how they're feeling, if there's any changes, if there's been any setbacks. I want to make sure that they have let me know everything that's going on. I'll oftentimes ask them, if they've done something different, if they've been traveling, if they've been doing anything that will have aggravated anything, or if they've done some things that have helped the area out. Either way, I want to sit and just talk to them for a few minutes and see how they're doing in case we need to change things up. So Julie's been coming in for a number of years. She oftentimes will get migraines, neck pain. She'll get that neck pain will affect the upper back, and usually the upper back is responding to things going on in the neck, and so some people will get upper back pain when it's really not the upper back that's the cause. She also gets some lower back pain. Julie's unique because she will tend to get some dizziness when she's not feeling well, if her neck's out, and so we want to make sure that we work and correct that. We'll talk a little bit about if she's experienced any dizziness, if she's had any migraines, and I try not to stray from the topic very often. I believe Julie at this point was telling me a little bit about one of her kids who is going to be getting married. And so there was a lot of stress involved. So here Julie's gotten on the table. I usually will just make sure she's laying straight, and then I will always go and check her leg length. I want to make sure that I know what's going on in her lower back, and I'll tell them that because of how the legs are attached to your hips, it can kind of give me an idea of what's going on in her lower back. With her, I've decided to start off on with these drops. The technique is called Thompson, and so depending on what the leg lengths show, it'll give me an idea of how to adjust that her lower back. Some people respond better to those drops than twisting. She does well with either one, and so oftentimes I'll do both with her. As I'm working on her, I want to find out if there's any muscle tension, if there's any inflammation in her back. I'm looking for a lack of movement. So as I'm pushing, I want to see if there's a lack of movement, if something's not sitting well or moving well. And then I'll usually go ahead and do those adjustments. This part here, this is not the Thompson technique, but more of they call it diversified technique. And I'll go through, and as I find the area that's out, I'll go ahead and adjust that. So I wanted to explain something. I've been asked before, as I'm working on people, or those, as I'm talking to people, if I do I do the same thing with each person? And do chiropractors, they just kind of go through the same thing, or are they just doing the same thing with each person? And I will explain that chiropractors will usually do the same pattern so that we don't forget anything. I want to make sure that I don't forget to adjust the neck or the upper back or address a certain area. And so you'll see me, or patients will see me go through the same pattern that I do each time, and it almost feels like I'm doing the exact same thing every time, but we're not, because it depends on what area needs to be adjusted, and it depends on how stiff or tight it is, and it depends on what direction it needs to be adjusted. So we want to make sure that as I'm working on somebody, I'll go to their neck next, and I'll palpate, I'll push around a little bit on their neck and find the area that's locked, and I'll adjust that area on one side. Then I check the next side and I'll push around and kind of see where it's locked up on that side. Sometimes it's similar or at a similar level. Sometimes it's not. There's a compensating area further away, and so then I'll check that side. But either way, each person is unique. Some people I have to be really gentle with, and I don't want to do very much. And even if it doesn't move very well or move very much at all, I don't want to push it. Other people respond really well to a little bit more of a pressure, and so or adjustment. So it might look a little bit more a little more forced or a little bit more adjusted. So at this point, I've put her on her sides, and so that we can go ahead and check her back up a little bit higher in her spine, so that we can get some movement there. A lot of times those upper vertebra will be misaligned or subluxated. That's a chiropractic word that we use when things just aren't moving very well, and so that we can get proper movement. But if it's not moving well, you can get radiating pain down into the legs. You can get pain out to the sides. Just depends on what area is affected. Then I go ahead and, like I told you earlier, we go ahead and I start adjusting her neck, and I want to find the area that's not moving. I don't want to just do a general one where I rotate the whole thing. I will oftentimes explain to people that when a physical therapist might adjust you, or an osteopath might adjust you, they will generally do more general adjustments, and it can oftentimes still feel good. But chiropractors are going to are more specific to the level of the spine, and so I want to make sure that I'm adjusting that level to be able to get movement in the joint, rather than doing a general thing, because that's not going to accomplish the goal that we want to achieve. What you've just seen is I've adjusted Julie. I reached around her back and put my fist right behind her back. Sometimes it feels like, or it looks like it's going to be uncomfortable, but the padding on the table is thick enough where when I lay her back down over top of my fist, it doesn't feel, or generally doesn't feel like it's a big old rock sticking in your back. I align my fist in a way that will allow for it to be a little bit more comfortable, but then I'll be able to get the movement in the area that I need to. In this kind of a situation, it's a little bit less specific, but generally we want to try to find those areas that are locked up and tight, or which areas are compensating for what's going on in the neck. And so I'll cross her arms over so that it will open up her shoulder blades and get it so that it will tighten up that upper back a little bit, or mid back a little bit, and then I can come back down and get a little bit of an easier adjustment. A lot of people like it when I adjust that way rather than pushing down because I have a little bit more control over how much pressure, and I can use their body weight to get the movement as well. So we've done that movement, her mid back, and then at this point, because it's natural to go ahead and adjust the kind of tug on the legs, that isn't something that you necessarily learn about in school, but it does kind of open that lower back or the hips a little bit differently than putting you on your sides or doing the drops. And so a lot of chiropractors will do that. We'll just kind of pull on the legs enough to be able to feel some movement in that lower back. Some people, they don't want me to leave or let them leave until I've pulled on their legs, and because they feel like it makes a pretty big difference for them. At this point, I oftentimes, depending on the person, I'll oftentimes finish working on somebody using this massager, that Ron massager. It's a pretty strong massager, and it kind of feels good to get the blood flow in the area, to allow for to help kind of the muscles relax. Depending on what I'm doing will depend on the goal, whether we're trying to get the muscles to relax a little bit. Specific areas, I might push it into the spine at an angle a little bit to get certain muscles to relax. For her, since it was more her lower back that I was working on, I focused a little bit more on the lower back, and then we feel like we can kind of end the adjustment at that point. She went ahead and I had her get up, and we changed the paper because we don't have to share the paper, and then we'll put you on one of the therapy chairs that we have. A lot of people like those chairs that you might see at Costco. This one's a little bit different than the Costco ones, even though it's the same company. And other people prefer laying down on the table and letting the roller go up and down their back. It's a little bit simpler. But this one stretches out her lower back a little bit. She likes that, so that's what she chooses. And again, her lower back tended to be a little bit tight, and so she was able to, it stretches her a little bit more on that lower back. And then she'll wait there for 5 to 10 minutes, and I'll usually move on to my next thing. And when she's done, she knows how to get up and then go check out with Valerie. So hopefully you've enjoyed the video, the explanation. I think it helps when you're unsure of what you're getting into going into the chiropractic office. And if you do enjoy this video, be sure you share the video with somebody or like it. But subscribe and let us know, if you have any questions or what you like about what we do. Okay, we'll see you next time.